Hi, I'm Dr. Barry Leibowitz, and I'm a certified sports chiropractic physician, and my specialty is the Graston technique. The reason I use the Graston technique is because it is a phenomenal way to break up scar tissue, adhesions, restrictions, muscle spasms, and anything that causes a restriction of range of motion and impedes an athlete or anybody else from doing what they really love to do. So Graston technique is a technique where I use instruments. I have 6 different instruments, and they're surgical stainless steel in all different shapes and sizes. And the reason I like these instruments compared to other instrument-assisted soft tissue techniques is because of the fact that they are surgical stainless steel and they're heavy. And because I can feel in the tissue when I start to rub the tool on the tissue looking for adhesions, I can feel a vibration in the restricted area that gives me feedback through the instrument, so I know exactly where to work. We also have all different shapes and sizes, and I'll be interchanging tools depending on which areas I work on his body. And the other reason I love to use Graston is because it really shortens recovery time. So athletes who are endurance runners or triathletes or, even 5 and 10K runners, people who enjoy being active, whether they're cyclists or any other kind of athlete, the last thing they want is an injury. So what Graston does is it helps to release the tissue, helping improve strength and range of motion, and that person can go back to their daily activities and their favorite sports sooner than later. The first area of the body we're going to work on today is the iliotibial band. The iliotibial band is a band of fascia running through the whole side of the leg, and it attaches up at the ilium, which is the hip bone, and down at the tibia, which is the shin bone. So you have this gigantic band of fibrous tissue that oftentimes gets very restricted. The reason for that is because it has 2 areas that it runs through, the knee and the hip, and if the hip is not moving well and the muscles are very tight, you'll start to get restrictions through the upper part of the band. The other thing that happens is down at the base of the band where it crosses over the knee joint, there's a groove that it goes through. And so when runners are running and their knee bends into 30-degree of flexion, this band tends to run in and out of that groove, creating a lot of friction. So repetitive injuries like constant running, worse on flats and downhill, is going to cause some lower iliotibial band problems. So the first thing I do, being that I'm a chiropractor, is I'll check the pelvis for any kind of misalignments. I like to work with the whole kinetic chain, so I'll adjust the hip, I'll adjust the knee, and I'll adjust the foot, and then I'll work to release the muscles surrounding the iliotibial band in the hip, down in the leg, in the quadricep, and the hamstring most of the time. So today, for the purpose of this video, I'm going to show you how I release the iliotibial band by itself. So I'm going to apply some cream to his leg, and already just applying the cream I can feel tightness at the lower part. Do you feel this? So what I'm looking for, my patients often refer to, is something that feels gritty. So oftentimes when a patient first comes in here, I'll take my tool and I'll run it through an area that I know is going to be pretty smooth. So we'll go to his quadricep. And do you feel that? Mm-hmm. Pretty smooth?
Yeah, it's pretty smooth.
And then I will go to an area where it's not so smooth.
Not so
And so this is pretty gritty in here. And so what I need to do is work with the tools to break up the gritty area. And then patients get trained and they're like, oh, I felt something gritty. Can you go back there? So our focus today is to find the gritty areas and break them up. This is my favorite tool for this area, and I call it my mini crowbar, but really it is super effective at breaking up iliotibial band adhesions. So I like to start at the top of the leg, and I'm actually going to come around here. The first thing I'm going to do is run my tool over this area. Do you feel how gritty this is?
What I feel is I feel gritty.
Does it hurt?
Now, the tool doesn't hurt, but I can feel the tissue underneath. It feels like it's not right.
Okay, so sometimes patients will be sensitive, sometimes they won't be so sensitive. And I'm just going to scan. I feel a lot in the upper part of the iliotibial band, a lot of grittiness. And as I come down to the middle, it's not so bad. Yeah. Do you feel the difference?
Big difference.
And then as I come down here toward the knee, start to pick up about this area. So I know that in this area and this area is where my focus needs to be. So I like to switch angles. I like to bring the tool from head to toe direction and from toe to head direction. And I'm going to start down at the base over here. And as I do this, and I can hear it and so can the patient, it's just a definite, distinct sound of almost sandpaper grinding on something. So as I start to do this, I see the tissue getting a little bit red. Sometimes people get what's called petechiae, which are little broken blood vessels. And sometimes people get really itchy because what this does is it brings blood to the surface, breaking up scar tissue and adhesions, and people get a histamine reaction where they get a little bit itchy, but that's very temporary. So he's getting pretty red, and when I see these petechiae, I know that I'm breaking up some good amounts of scar tissue that have a heavy blood supply. And I'm going to check in with him. How are you doing?
Doing okay.
You're okay? He's definitely turning a little bit red down at the base, which we knew is the problem area. And what I like to do while I have him in this position is get a little bit back into the lateral hamstring and work on that as well.
Oh, yeah.
And he feels it definitely back here.
Mm-hmm.
Then, like I said, I get into the quad.
That right there is probably the worst.
So a lot of times, like he's doing, patients will give me feedback. Then what I'll do, because the top part of the iliotibial band is the TFL, otherwise known as the tensor fascia lata muscle, and it actually sits in here in the hip area. So I don't like to ignore it. I'll take a smaller tool, and I'll kind of just get in there and feel around and break up the tissue. Are you sensitive up here? So he's a little bit sensitive up here as well.
Not too bad, not as much as down by the knee, but.
So I'll spend some time up here. And then because it's all a kinetic chain and I don't like to ignore the rest of the leg, I like to address all of the muscles that are playing into this iliotibial band problem. I'm going to drop his leg off the table, so I'm going to have you roll it over a little. You okay like that? Get a little more lotion. And I'm going to get up into his gluteus muscles. And then come down with my other tool and really work on these muscles up through here. Can you hold the shorts for me? Yep. Thanks. So I'll really get in here. So now we're addressing all his gluteus muscles, coming down into the iliotibial band, the top of it, coming back up. And this in combination with a chiropractic adjustment.
It's interesting as the tissue already feels clearer.
So his comment is the tissue feels clearer. So when I feel this, we have a little bit of grit left in here, and then it starts to feel smoother coming down. Yeah. Now, the thing about Graston technique is it can take 6 to 8 sessions to break up all of this tissue. The longer the problem exists, the longer it takes. The most I've seen with chronic, horrible iliotibial band is after about 1 visit, people start to feel a lot better. After 2 or 3 visits, people who haven't been able to sleep on their sides are now sleeping on their sides. Knee pain goes away. People can go out and run. 6 to 8 visits is the maximum I've ever treated anybody, and it's completely cleared up the problem, any problem in the body. Now, if you notice in here, there's a little bruising, very, very common. I always instruct my patients to go home and put ice on afterward. I wait 2 or 3 days until this clears up before I do another Graston session. So the last part of this is I'm going to have you lay on your back. And I've already put some lotion. Go ahead and bend your knee for me. This knee, and you can, yeah. I've already put some lotion on his lower leg. So I'm going to get into the muscles here and roll these out as well, so I can address all of his leg. And especially because the iliotibial band connects onto the tibia, I want to make sure that the muscles surrounding the tibia are nice and loose. So I spent a little time on this area. So the last thing that I do is adjust the knee for iliotibial band. I want to make sure that the femur is lined up with the patella and that the patella is lined up with the tibia and fibula. So what I'm going to do is have you relax for me. Good. So now his hip's been adjusted, his knee's been adjusted, and the last thing I'll do is his ankle to make sure that whole kinetic chain is addressed, and we got a nice release there. And there you have it. That's our treatment for iliotibial band. So if you're suffering from lateral knee pain or pain during running or unable to sleep on your sides because you have a lot of tightness through your hips or down your lateral leg, come on in and see me. I offer a free half-hour treatment for your first treatment, and I can show you what Graston's all about. Thanks for watching.